And I recognize the member for Toronto-Danforth.
Thank you, Speaker. Speaker, my question to the Premier. Sarah Block is a constituent of mine who is disabled and dealing with an autoimmune disease. She recently required surgery, which left her with very limited use of her hands. Even after begging, she could only get 4 hours of home care per week after the surgery. Can the Premier tell us if he considers this adequate care for a person facing profound limitations?
I recognize the Minister of Health.
Thank you, Speaker. While I obviously cannot speak to an individual example, I'm happy to follow up with your office if you provide that information. I think it's important to appreciate and understand that we have been making substantial investments in our home care sector. There is no doubt that as people transition away from hospital acute care, they need those supports in community. Sometimes that can be a rehabilitation centre, sometimes that can be a long-term care centre, and sometimes it can be in their own home. We are making those investments because we absolutely understand how important it is for people to be able to continue their recovery in the most appropriate place. Thank you, Speaker.
Back to the member for supplementary.
Again to the Premier. Ms. Block developed a bleeding rash because 4 hours of care a week was not enough to provide her with adequate hygiene. To avoid further complications, she had to hire someone to provide supplementary care she could not afford on her disability income. Again to the Premier. Why does the government provide such limited care that people are left to suffer or go into debt to avoid further illness?
Recognize the Minister of Health.
So again, I will remind the member opposite that as Minister of Health, it would be inappropriate for me to comment on an individual case. What I can tell you is we continue to make investments in the home care sector because we have seen the value and importance of the service that they provide. You know, when we hire and train more personal support workers, when we ensure that we have a learn and stay program that allows nurses who want to train in the province of Ontario the ability to do so without covering, with the province of Ontario covering their tuition in the books. Those are investments that we are making to ensure that individuals like your constituent and people across Ontario have access to those critically important services as they access our healthcare system. Thank you, Speaker.